not to do squats?
With discectomies, you should never do squats. Okay, hello, Dr. David Kulla here with Synergy Wellness in New York City. Today we have Neil here. We just did a video on him about a hyperextended knee, but this one is about a discectomy. So Neil had a discectomy. For those of you that don't know what a discectomy is, it's an operation, a surgical operation. It's probably the least invasive of the disc surgeries that are out there. Let's put it that way. Aside from maybe spinal injections and cortisone shots and epidurals, okay? Those are less invasive than a discectomy. But an actual surgical procedure of the disc, a discectomy is the least invasive. It's where they kind of cut away a sliver of the disc, not the whole disc, not replace it, not fuse it, not cut through the bone like a laminectomy. We've done videos on that, but this is just where they cut the sliver of the disc that's either irritating or maybe pressing on the nerve. And depending on where the disc is herniated, sometimes they can't do a discectomy. So it just depends on each case. And again, if you can avoid all the other surgeries and just get a discectomy, that's the way to go. If you can avoid the discectomy in the first place, you're much better off. I didn't get my hands on Neil until after the disc injury. And did you try chiropractic care after the disc herniation initially, or were you were in so much pain that you had surgery pretty quickly, didn't you?
Yeah, I wasn't able to do anything. No position was comfortable.
Yeah, so now I'm not saying that I would have prevented him from getting that discectomy, but there's a good chance I would have, okay? We see a lot of really severe acute cases, and we get them through it. We just had one guy this week, and his case, he's got disc extrusions, which is much more complicated. So we're not going to go into that. This is a discectomy, and we're going to treat it with Cox flexion distraction technique. That is hands down the best technique for this. And for anybody that's had any back surgery, this is a very safe technique. So if you've had back surgery and you're watching this, it's safe. Just make sure you go to a doc that's certified in the technique and knows what they're doing, takes you through all the protocols. And for those docs that might be watching this, yeah, I just skipped the protocol because we've already done flexion distraction technique on him. So I've already got him in protocol 1 here. And it's a gentle motion here. How you doing there? A little tight today?
Oh, yeah.
Busy week?
I worked 16 hours straight yesterday.
Oh, wow. Okay.
Taking the afternoon off today.
Good. Were you sitting all day?
I alternate, but, most of the time, yeah.
Okay. So me and Neil here have spoken about sitting and how sitting increases pressure on the lower discs in the lower back. So if you wonder why sitting after a while aggravates your back, or you have sciatica or numbness or tingling down your leg, that's why. You're adding more weight to the discs, more pressure on the discs in the seated position compared to the standing position. It's about 225 pounds of pressure on your lower discs seated versus 150 pounds of pressure with you standing, okay? And those numbers vary depending on your weight and size, and whether or not you're here on planet Earth or up in space on the Blue Origin shuttle, where you have zero gravity. Now, this technique opens up the facet joints, opens up the back of the space where the disc is, and it helps to pump nutrients into the disc. How we doing there?
It's a good stretch.
For those of you that didn't hear him, he said it's such a good stretch. It really is. This feeling is pretty incredible. For him, because he's had a discectomy, we are not going to put him on his side. Now, sometimes there may come a time, where I might need to put him on his side and do a very, very, very gentle adjustment. But it's typically just to adjust his pelvis, not his lumbar spine when I do that. So if you have a disc herniation or a disc bulge or sciatica, you want to be careful doing the side posture where the chiropractor puts you on your side and adjusts you that way. It works for most people, but you want to be careful about that, especially if there's arthritis or a disc fissure or extrusion, where it could make, that technique could actually make the person more symptomatic, and you don't want to do that. So, okay. Now we're going to come in here for Neil and just loosen up the muscles here on the side. There's a lot of ways to do that. You can do cupping. You can use a lacrosse ball. We have a PTLMS machine. This thing is very effective. Okay here? Doing okay? So after we loosened up the soft tissue down here and throughout his whole spine, we're going to come back in here and do some more flexion distraction. And it should be easier for you, Neil. Is it a lot easier?
Yeah.
Yeah.
Especially on the left side.
Okay, good. Perfect. So some of the things you want to watch out for if you had a discectomy. You want to avoid squats. You don't want to do squats with a weight, a bar, across the top of your shoulder. That bar will compress the spine, and you just don't want to do that. You don't want to compress the spine. So just certain things to be careful of once you've had surgery on the back, like a discectomy surgery. Okay. Now, I'm going to have you keep your legs straight. Raise one leg at a time. No, keep your whole leg straight and raise the whole leg up. Yeah. Good. And down. And the other one? Good. How'd that feel?
The right one felt tight.
Okay.
The left side felt like it had a bit more flexibility than usual.
Okay, so the right side tight and the left side easier to raise?
Yeah, for now.
Okay, so cross your right ankle over your left ankle and slide up for me. Good. So you'll notice what I'm doing here, I'm having him cross his leg over. It's because his sacrum is rotated a little bit, and that's why it's a little harder to raise this leg. So uncross that leg and try that again for me.
Yeah, it's a little better. Around right here is where I start to feel a shooting pain going up this way.
Okay. Cross that right ankle over the left again. Uncross the legs and try to raise them up one at a time again. Okay. Good, and down. How's that?
A lot better.
Good. Okay, turn over on your back. Tuck your chin down, take a deep breath in. Good, blow all the way out. All right, and lay back. The neck feels pretty good. Better than last week.
Oh, I got a massage.
You did, okay, good. She did a great job. It's right there, gotta correct that. All right, great.
Nice.
You're all set. And folks, if you have any questions about discectomies, comment below. Thanks, Neil.